the first cohort of this trial suggested that there was no drop-off when we went from lenalidomide-containing regimens to pomalidomide, and so now we're exploring one of the more important current combinations that we're using, which is the combination of corticosteroids, pomalidomide, the most active of the IMiD compounds, and daratumumab, the most active of the monoclonal antibodies that we have. And we have significant historical data on what expected response rates in pomalidomide, daratumumab containing regimens. And the question is, if we move now straight from a lenalidomide containing regimen to a pomalidomide daratumumab containing regimen, what happens? Now, this particular trial is relatively early. These are patients after first and second relapse, and what we see is that we see a higher response to the combination of pomalidomide, daratumumab, and dexamethasone in this trial than we've seen in any other trial. Something that I guess is expected. The patients are a little bit earlier, but something that might not be expected because these patients are progressing directly from lenalidomide. And so ultimately the moral of the story is that prior refractoriness, progression of disease on lenalidomide doesn't impact on our expectations of response to pomalidomide, nor to pomalidomide-based combinations. And I think that that's a very important lesson to be learned practically.